I never, in my worst nightmares, would have ever thought that I'd be bearing a child. And I was 40 weeks pregnant, and my water broke, and we went into to bring and welcome the joy of our life. And one moment you're at this high of like life, and the next moment you're like the worst. And so surviving that, I think, was the hardest part. I think everything else in my life doesn't amount to being able to survive the death of my child. And I, went back on medication. I struggled with, wanting to survive or not, but what helped me was positive relationships that I had in my life and peers.
So one of the things that makes Peers really unique and really special is that it's an organization that in every way manifests the motto, nothing about us without us. Most of the people, the vast majority of the staff there are consumers of mental health services. We have that lived experience of what it's like to live with a mental health issue. In California, 1 in 5 people are living with a mental health issue. Chances are that someone in your family or someone that you care about is impacted by that.
I was struggling, but I knew I had to hold it together because I was so passionate about what we were doing as an organization within our community that it gave me hope.
Because we believe what goes into that experience of having mental health problems or issues is a complex one. It isn't just about all of the responsibility for the problem is on the person, that it's something that's wrong with you. It's what's going on with our society. It's how you respond to experiences of poverty, of racism, of stress in your family.
I would say my experience has been lifelong with challenges of mental health issues. And it began with, when my family escaped Afghanistan and we came here to America as refugees. And we had a community, but then it became a closed community, a community that experiences trauma and kept it secret. And so I learned this, from a young age, that when I struggle, I have to keep it internal and not share.
Social inclusion is the radical concept that people with mental health issues shouldn't be segregated from the rest of society.
For so long, decisions were made about our, treatment, our wellness, our future without us.
But whenever you take a segment of our society and say, you aren't valued, what you have is wrong, is different, then we cut ourselves off from those gifts that people might bring.
For someone to want to make big changes in their life, they have to be included, they have to be involved, they have to be the drivers of what they want. And people have been told that this diagnosis, this illness is lifelong, and again, you lose hope, because who wants to live with a stigma and feel like you can't recover, when reality is you can, and people do, and research has proven that.
So what Peers is doing is going out with the social inclusion campaign and saying no more should people be hiding in the shadows with their mental health issues.
People with mental health diagnoses are dying 25 years younger than the average population.
So instead of traditional protest models, which we still feel have a place, the emphasis of our campaign is about finding the bright spots out there in the community. This is not about replacing traditional medical interventions. It's about offering more choices.
And so we're trying to empower people and say, what is your choice if you were given it?
But it takes a lot of courage for a person to get in front of a nondescript group of people and to tell the things that you're told. All I can say, man, is that when I grow up, I want to be like you. And that's really honest.
Individuals come to Peers for support groups and personal development trainings, but we are also out in the community trying to change society through mental health and wellness advocacy.
It isn't just about something that's wrong with the individual on a biological basis, and therefore takes the responsibility off of our society to change. It's a problem that we all share, and we all have a responsibility to make a different society that mental health and wellness can arise naturally within.